Hello, everyone. I am happy to introduce our last panel of the day, women's rights. This is actually the one panel I insisted during our planning for this year's Mobilize Women that we must have a panel on women's rights because it is extraordinarily important to all of us. But what I'm going to do, because you've been seeing her all day long and no one has properly introduced our CEO, Anusha Harid, I am going to do that. You saw today in the opening slide, those of you that were with us in the morning, that she's currently the CEO of Elevate. But what you don't know is why she's the CEO of Elevate and why we're all so lucky. Anusha is not only brilliant, but she has a global background. We are a global organization, so having a global CEO is important. Um, she's worked at large corporations like Goldman Sachs. And no, you don't have to have worked at Goldman Sachs to be in management at or be CEO at Elevate Network, but it seems to be a theme. She also started her own successful fintech company and now wears the hat of CEO at Elevate. So we are so lucky and happy to have Anusha with us today. And she is going to take it away and moderate the next panel. Welcome,
Thank,
Anusha.
thank you, Ali, for that generous introduction. I am just absolutely honored to moderate this important conversation on women's rights and what's top of our minds in 2025, and where there is still work that urgently needs to be done. So let's begin by introducing our panelists. We have Sabrine Chaudhry, who's the vice co-chair for Saki for Survivors. Welcome, Sabrine.
Thank you for having me.
We're joined by Jamila Galloway, who's the VP of Content and Culture at Planned Parenthood. Welcome, Jamila.
Thank you. I'm excited to be here.
We're delighted to have you. We're joined by Julia Taylor Kennedy. She's a senior director at the Center for Reproductive Rights.
Hi, great to be here.
Great to have you. And we're joined by Molly McGrath, who's a director at the National Campaigns for Democracy at the ACLU. Thank you, everyone, for making time.
Thank you.
And what can I say? I feel as though we have a lot of ground to cover. So I want to get into it because I feel as though we could fill a day just talking to each of you. But my goal today is to leave our audience with a sense of what each of you are focused on, your priorities and action steps. So I'm going to first start with you, Sabrine. Throughout your work in gender-based violence and at Saki, you work with survivors navigating systems that often fail them. What are some of the persistent barriers that these survivors of gender-based violence have to face, and what is needed to better center their rights?
Great. Well, thank you, Anusha. And a big thank you to Elevate for having a session on such an important topic. I'm both honored and humbled to share the virtual stage with such an amazing set of women and just also share the summit with such an amazing set of discussions that we've already had today. So as you covered in my background or in the intro, I've had over 20 years of experience, both as a practitioner and having done academic research in gender-based violence. And as you hinted, there's many kind of systemic barriers in this space. But the three that I would highlight based on my experiences are first and foremost on the preventative side is really helping educate young men and women early on how to understand what constitutes a healthy relationship and a healthy friendship, and helping young men and women understand how to identify early signs of unhealthy relationships and really address them early on. The second area I would say is, and this has been mentioned before throughout the session today, is around financial freedom, enabling economic independence, and unfortunately financial abuse is one of the biggest barriers and the biggest reasons that survivors are unable to leave unsafe situations. I'll get into that a little bit further on. And the third area is really around incorporating and addressing the cultural nuances of abuse across all the services that we provide, whether that be legal services, whether that be mental health services. And when I talk about cultural services, I don't mean culture just in the sense of race or nationality. I mean that in terms of, socioeconomic needs. I mean that in terms of it could be stylistic needs. A lot of the times when we talk about gender-based violence or violence against women, we think of it as a homogenous issue or, like a one blanket issue. And so we don't think of the solutions in unique terms. And of course, we want to have solutions at scale, but at the same time, I think it's important to think about the solutions through the different lived experiences of survivors. Now, I could go through each of these three for a very long time, but the one that I want to touch upon, and I think that would be quite relevant for this audience, and my background is also in financial services, is the one around economic independence and financial security. And I wanted to just share, in the US, the leading cause of death for women from 15 to 44 years old is domestic violence. And the number one reason women don't leave is because of financial insecurity. At Saki for South Asian Survivors, which is an organization that, while we cater to South Asian and Indo-Caribbean the communities in New York, we're open to everybody in New York. 70% of our survivors endure unsafe homes because they're not able to have the funds to leave. And not only that, if they're able to find the funds, they're not able to get a lease, they aren't able to get a guarantor, they don't have a strong credit score. And then there's also a wide spectrum of financial abuse that spans across socioeconomic cohorts, right? It could span from coercive debt, it could span from large amounts of jointly held banking that's abused. It could stem from restricting access to bank accounts. And so we see it can go on and on and on in terms of definitions of financial abuse. To get to the positive side of how this is being addressed, I think there's two ways that we're seeing it. One, at Saki, we have a dedicated economic empowerment program that works with survivors to meet them where they are and set up individual financial services plans to teach about financial self-sufficiency, job readiness, credit repair. On the other hand, I've been working with an organization called the Green Foundation, and they've published a very interesting report called the playbook, the role of financial institutions in responding to domestic financial abuse. And there they've really highlighted, and again, I think this will be relevant for this audience, ways that financial institutions are really thinking about addressing financial abuse. And so some of the things they highlight is educating branch managers and financial advisors in wealth management in identifying when financial abuse occurs. And then even using technology as innovative ways to add product specifications for survivors. So for instance, there's a mobile banking app in the UK where you can chat if you're a survivor of financial abuse, and the chat will delete instantly once it's reported for safety. Or when you lose it, similar to when you lose a credit card and you're able to lock a credit card, there's another mobile banking app where if you feel that your partner or spouse is fraudulently using a joint checking account, you can lock your checking account through an app. So I've talked for a very long time, but I just wanted to highlight that there are some quite innovative elements happening in this space through financial services institutions to address the systemic barrier of economic lack of economic independence, which drives gender-based violence.
Thank you, Sabrine. And I think one of the things we've been seeing as a theme of today is we've been putting a spotlight on topics that we don't shed enough daylight on. And given our prior conversation and the extremely sensitive nature of this topic, Sabrine, you've authorized us to share a link where if anybody in the audience or anybody in the audience knows someone who ought to would like to reach out to Sabrine or Saki, we'll make sure that's available in the chat and you can do so in a confidential manner.
Yes, absolutely.
And I think it touches on kind of the state of rights. And in some cases, there is some movement, but we are so far away from where we'd like to be or where we aspire to be. I think that is my big takeaway. I want to bring you into the conversation, Julia. You're at the Center for Reproductive Rights. You're working on the front lines of policy and litigation. And I think similarly, same question, kind of what is your current assessment of the battles or threats, in your case, threats to reproductive freedom that are most urgent? Where do you see signs of progress and hopefully also some signs of resilience?
Well, there's a lot of all three of those things. And so I appreciate the question, and I'm going to do my best to cover a lot of ground. And also just to say, I'm thrilled to be here. So glad to be included, and so glad you're putting this topic on the agenda. I understand that the Elevate Network members identified this as something they're really interested in learning more about. And so I'm happy to bring what I can in this conversation, and to bring more if you want to be in touch afterwards. But just to put, back on the table, to take us back a little bit, we're talking about rights and access to rights at a really critical time, because in just a couple of weeks, it will be 3 years since the Supreme Court took away our right to reproductive freedom. It is the first time that we have lost a human right in this country. It was a huge development. And what we learned, that is a huge challenge and a threat, right, to our freedom. But on the flip side, there was an immediate sign of resilience, which is what we learned when that right was taken away, from the enormous outcry across every part of this society, including the private sector, is that access to abortion is incredibly popular. Most Americans, like 80% of us, want abortion to be legal. Of course, there's more variety in terms of what our elected leaders want. And so since the Dobbs decision came down 3 years ago, states have moved in a variety of directions. We've seen 23 who have expanded or protected access to abortion, and another 23 that have put into place either hostile laws or where abortion is now illegal. And so in our tracking at Center for Reproductive Rights, that leaves just 4 states where abortion isn't protected, but there aren't hostile laws on the books either. Why do we track this so closely? Because we're a nonprofit, non-partisan organization that has been working to expand access to reproductive health and rights for 3 decades. And at CRR, or the Center for Reproductive Rights, we do that primarily through legal action, either by filing lawsuits or through policy advocacy. We are global with 5 offices across the world. And when we talk about reproductive health care, we're talking about the full suite of healthcare that we each need over the course of our lives, from contraceptive care to fertility and assisted reproductive care, to abortion care, which 1 in 4 of us will have in our lives, to maternal health care. So obviously, access to these different types of care is very intertwined. And there's a lot at stake when we're talking about reproductive freedom, because it affects us for decades of our lives. At CRR, we work on these issues at the local, national, and global levels. But of course, right now, we have a very heavy focus on the US, given all that I just described that's happening here. And there's a lot to worry us right now. I'm just going to walk through the top 3 areas of concern. And just keep in mind, because abortion access is so popular, those who are looking to restrict it have resorted to being really kind of sneaky about it. So the first is, you're probably reading about budget reconciliation happening with the federal government right now, and a debate over whether to cut Medicaid. And if these sizable cuts and additional cuts go into place, that could cripple reproductive health care access for the most vulnerable in our country. And I'm sure Jamila will speak more to this. But the grave concern is that if local health clinics can't survive in banned or protected states, that means the people who really need help getting services won't be getting their cancer screenings. They won't be getting their birth control prescriptions, their prenatal support, their postnatal support, let alone access to emergency or voluntary abortion care. Second worry is about cutting off access to medicines that are used in medication abortions. These medications have been proven to be safer than Tylenol, and they're used in miscarriage management, cancer screenings, and 60% of abortions across the country. There are non-peer-reviewed studies that are swirling around, published by political advocacy groups, that RFK Jr. and some senators and the head of the FDA say are causing them to reconsider the approval of medication abortion, which has implications not just for abortion access, but also for the reliability of drug approval processes in this country at large. And then the third worry that I'm going to raise is that we're creating, in essence, two different societies within this country. In states with strict abortion bans, maternal health care deserts are growing, where people don't have access to an OBGYN close to their home. And people are worried that something random might come out of left field, like the loss of access to IVF that Alabama experienced last year. And so that makes it that much harder for all of us as employees, as working people, to take the time to afford the expense it takes to get to the one medical appointment that most of us have every year. It also means that more people are choosing to move out of banned states, which has huge economic implications and is a classic case of brain drain. So those are my top three. Very quickly, progress and resilience, interesting things happening on the state level. New York, California, Colorado, others shoring up their protections for telehealth providers and doctors who are willing to prescribe medicine to patients in other states. In states where abortion can go on the ballot, voters have been showing up in huge majorities to affirm that they want their reproductive freedom. So that is incredibly encouraging. And badass advocates are emerging in this movement, not just the professionals. And I have some amazing lawyers as my colleagues at the Center for Reproductive Rights who give up big law perks, right, to be out there fighting for our rights and our access. But even more, the people who are out there making sure that the patients who slip through the cracks are seen and heard. We represent plaintiffs with very wanted pregnancies who needed abortions due to life-threatening pregnancy complications and are living with the trauma and literal scars from not being able to access that care when they needed it. Dozens of them are joining lawsuits, speaking out to the most powerful in this country. And their courage to tell their stories over and over again to lawmakers, to the public, to people in power. They could stay quiet, they could return to their lives, do their best to heal and move on, but instead they've planted their feet and they're fighting. And I think there is no better sign of the resilience of the human spirit.
So it's interesting, Sabrine and Julia, when we started hearing you speak, I felt like it was a bit of the facts are a visceral gut punch. When I heard, Sabrine, you talking about, kind of the various forms in which that violence can take. And Julia, you used a phrase that we lost a human right. That really sharpens everyone's attention. But I think the silver lining is kind of the next piece that you both spoke to. Jamila, I want to pull you into the conversation because, of course, Planned Parenthood, you're living in kind of in the same sandbox as Julia, but there's a very specific angle that I would love for you to talk about. There are two pieces. One, in this climate, there's misinformation. And we talk about misinformation. How do we make awareness? How do we achieve believability around healthcare, around reproductive care? I'd love for you to speak about how your team is putting strategies in place, but also if you can set the stage for our audience in terms of all the services that Planned Parenthood provides, and set that as the context for why that misinformation is so damning. I think that would be very important for everyone to hear.
Yeah, absolutely. And I'm very excited about this question. I probably won't get all the services because there are so many, but I'm going to name, just to give you all like a broad sense that it is certainly more than abortion care. We do birth control, STI treatment and testing, cancer screening, wellness exams, vasectomies, family planning. I'm trying to think what else are some of the main ones. I feel like those are the main ones that and obviously gender affirming care as well.
That's a long list.
Yes.
And then how does that then tie into the misinformation piece, right? Because I think there is a narrative there that I think you want to share with us.
Yeah. So as you can imagine, misinformation, disinformation is definitely a challenge for us, especially as a healthcare provider. It's everywhere surrounding us. It's online, it's offline, it's in TV, film. We just can't get away from it. And what it does is confuses and divides us. We have a difference in opinions and what we believe. And, not to mention, this is something that abortion opponents use to fuel their agenda to shut down Planned Parenthood health centers and further ban abortion. So take, for example, Julia mentioned earlier abortion medication, right? This has been in a news cycle for some time now, and I think pretty consistently since 2022. This is an area where our leading source are abortion opponents who are driving disinformation, making false claims that it is extremely unsafe and that it's fatal. The truth of the matter is it's extremely safe and effective when used as directed. In fact, it has a 99% safety rate when used within the recommended time frame, which is up to 10 to 11 weeks of pregnancy. It's FDA approved, used worldwide. Like, it is safe. Like Julia said, it's safer than Tylenol. When going back to your original question around, like, what are we doing? Like, how are we managing this? We have a lot of ways. I want to lean a bit into a few. So social listening is a big one for us. We use social listening tools to understand the online conversation related to sexual and reproductive health and Planned Parenthood. We're also on our social platforms doing moderation and community monitoring. And what this does is give us as close to real-time data as possible to understand what is out there and where we need to counter these threats. The second thing that I really absolutely love is leaning on our trusted messengers. So our trusted messengers are seen as like our storytellers, our celebs, our brand partners, our influencers, content partners, and so on. And the reason we're able to leverage them for misinformation and disinformation is for the fact that we know they're credible, they're relatable, they have a built-in reach, and very importantly, they have the ability to shift public opinion. So misinformation will be a problem for us for a long time. It has been before my time. It will be after our time. And we do continue to find various ways to counter it. As you can imagine, in this moment, as the threat of a defund grows even louder, it becomes even more critical that we're breaking through, that we're countering these false facts, and that we're able to mobilize audiences.
That's very helpful. And I think we will come back to kind of the trusted partners question, because I want to double click on that. We saw, celebrities make endorsements during the previous election. So I definitely want to circle back on that piece during our next set of questions. Molly, I want to talk about what ACLU's priorities are when it comes to a whole host of rights, but prominent among them on my mind are voting rights. But when you and I have been speaking, that's not the only, that's a subtopic in a laundry list of topics. So please catch us up to your current 25 to 26 tactical plan, as well as broader strategy.
Yes, absolutely. And I just want to echo the sentiment of appreciation to be here and grateful to be in this space on this panel and with everyone here at the convening. So at the ACLU, especially when we look at our democracy work, our voting rights work, we really have as our North Star that every eligible person can vote, and that vote is counted, and that those results are honored. And so we work toward that North Star through a series of organizing, through litigation, and through advocacy work as well. And we also view, voting as really like the foundation of our democracy. So that is the way that we participate, that we engage, so we can protect our reproductive rights and everything else that we want to weave together to protect. So what this looks like, holistically, as we work to protect and defend our rights and advance our rights, in particular our voting rights. We work at the federal level, and so that looks like making progress where we can. Lately, we've been on the defense and fighting against legislation like the SAVE Act, an act that would require voters to provide their documentary proof of citizenship, so a passport, naturalization paper, or birth certificate in person every time they vote. and or every time they register to vote to their election official's office. And so that's burdensome for two reasons. One, because you have to procure those documents, which is, in particular a burden on lower income and transient folks. And two, you have to do this in person every single time. So also, students, people who move around a lot. So we're fighting against that at the federal level and looking for opportunities where we can as well. At the state level, we have a similar approach, and we've seen progress in movements in states like Colorado, with the Colorado Voting Rights Act passing this past session. And we're also fighting back against similar proof of citizenship laws at the state level as well. And whether it's voting or reproductive rights or whatever it is where we're fighting at the federal and state level, both to advance and defend, this is kind of all under the umbrella of how do we build our power, and how do we I say I'm a lawyer, but my colleagues are the ones who litigate, or they're in courthouses, but we're kind of doing all the other lanes. We're in the court of public opinion. We're in the halls of the Capitol or state lobby buildings and all these other kind of places. And that's like that power building. Like, how do we get more folks in the narrative change on our side to understand the issues we care about, to see the impact on how it impacts their life, lift up the voices, of impacted people and influential surrogates. And how do we bring, volunteers in to do the same? And so that's really growing our people power. So like an example on the voting side, those folks would help with GOTV to make sure that everybody can cast a ballot that counts, that they know what to do in their state, they know those deadlines, they know where to go. Or that people power can also be used on the voting side to safeguard the election. In 2024, we put up the ACLU, we put up the largest safeguarding program, enlisting more volunteers than ever before to be poll monitors, to go to counties to ensure the results would be certified. And so how are we bringing more folks in to protect our democracy and our other civil rights and civil liberties?
Thank you for that, Molly. I'm going to take a playbook from Jamila here and ask a question to all of you. If you can share one statistic or one fact or one piece of information that really crystallizes your priorities, brings into sharp focus for our audience, I'd love for them to hear kind of that piece, because it allows us to hold on to the truth in some sense. So on this one, I'd love to start with you, Sabrina, again. What is that one?
I might cheat a little bit here, and instead of one, do three quick ones. So, unfortunately, these may be known to this audience, but 1 in 3 women experience some form of physical or sexual violence from an intimate partner in their lifetime. 1 in 2 experience some form of emotional abuse from an intimate partner, and of all women who experience physical, sexual, or psychological abuse, 99% experience financial abuse. And so that just highlights the high rates of financial abuse. And we don't really talk about financial abuse often. I saw in the chat someone mentioned how great it is that we're talking about financial abuse in the vein of violence against women. Oftentimes it's just so broad of a topic. So I just want to underscore how pervasive financial abuse really is, across our cohort or across this issue.
Jamila, I'll turn to you. Sorry, you're on mute.
There we go. I am like Sabrina. It is going to be very challenging to just give one, especially in a time where breakthrough is such a priority. There's so much out there that is distracting us, consuming us, and right now we need people to listen. So I want to share several facts that will just give a fuller picture of what's at stake. So let's start. First of all, 1 in 3 people have visited a Planned Parenthood health center in their lifetime for affordable and quality care. I've listed the services, so I won't go back into those there. But if we were defunded, we're looking at 200 health center closures. And of those 200 health center closures, 90% are in states where abortion is currently legal. So imagine that there's even further restrictions on abortion access. And if we think about numbers, that would immediately impact 1.1 million patients, many of whom do not know what's going on, many of whom Planned Parenthood is currently their only source of care. And just to give you guys a sense of where we're at, like we've been here before with the overturning of Roe. A year post, so in 2023, there was a record reported of Planned Parenthood patients having to travel out of state an average of 5 hours and a median of 184 miles. This is just for one service, abortion care. So imagine if Planned Parenthood is your only source of care in your area and now you cannot get that care.
Thank you, Jamila. Molly, I'll turn over to you, and then Julia.
Mine is really specific. Ready? 79,043. And that is the number of volunteers who have joined the ACLU, our People Power, our volunteer arm of the ACLU. That's the number who have joined since the election. And that is a huge statistic, and one that we're really proud of because, as I said, defending our rights and isn't just a job for ACLU lawyers, it's truly a job for all of us. And it's been really inspiring to see how many people are inspired to defend our democracy, to take action, to speak truth to power. And I think that number really illustrates it.
Go ahead, Julia.
It's very hard to follow. These are such important statistics that you all are sharing, and I think it's such critical information. My job at CRR, which I haven't even really talked about, is to work with business leaders to support reproductive healthcare access. And so I did reference brain drain earlier, and our program is really working to build out the information and statistics that are available on the brain drain that's occurring. So the first one is 1 in 5. We all have 1 in something, right? 1 in 5 people who are thinking about having kids in the next decade say they have moved or know someone who has due to the bans. So that's just in the last 3 years. Lots of people are picking up, uprooting their lives and moving. Second number that we've collected, 56%. That is the proportion of employees who want their workplaces to be partnering with lawmakers to expand access to reproductive health care. And so they see their employers not only as their source of healthcare benefits, but as their advocate to make this issue better for them. And then the last one that I will share, although I have many more, is from a study, an economic study called the Turnaway Study, which found really powerfully that women are 3 times more likely to leave the workforce if they don't have access to an abortion, and they're 4 times more likely to live in poverty. So the consequences of what is happening, is so real, and they go deep into our economy, not just into our day-to-day healthcare.
Thank you, Julia. There's a theme emerging amongst the chat, and I want to kind of pull a few different questions together to one question. I'm going to pose this, Molly, Julia, and Jamila, because it's a response to how can we act. The people power theme, Molly, is the one that's emerging in the chat, and it's pertaining to how can we act in this moment, in this political moment. So the way I'll frame it back to you is, what are the forms of organizing, advocacy, or care that you're seeing emerge? And please talk to us about strategies, grass tops, grassroots, digital. We want to talk, Jamila, on the use of trusted advisors like celebrities. But I think that's the theme. What can we do? What can we as the audience do? So please, Molly.
Sure, I can kick us off, and know that all of us at our organizations enlist a lot of those tactics with surrogates, unlikely allies, and building that bench and other work as we push the envelope here. But as far as what we all can do, there's a lot. And one thing that I'm seeing, in particular, going into this year and kind of the trend in some of this is a real appetite, hunger to do things in person. I think during COVID, we did a lot of, virtual things, virtual phone banks. People were much more isolated in their activism. And right now it's this huge appetite and resurgence to do things in person. And it's really exciting. An example that I have is we have had several town halls in different states and districts. And we did one in Alaska on the SAVE Act. We've been doing some in different different districts on Medicaid because of the impact on Planned Parenthood and the impact on people with disabilities. And as we do these town halls, as many people are showing up in person as when we do a virtual town hall for, an entire state. So we're really seeing like a thirst for people to do things in person. So if you're there and you're like, what can I do? I would say here are some of the top 3 things you can do. One, you can join, the ACLU People Power. We can drop the link, or any of the, other organizations here who do incredible advocacy, and stay up to date on some of these issues and actions. We're doing town halls, we're doing in-district, in-state events. And so there's tons of opportunities to join those in-person events. There's also opportunities to engage in that advocacy, if that's making a phone call to your rep on one of our issues, if that's making a phone call to your senator, your rep, your governor, whatever that is most ripe at that moment. We're also doing trainings to really make sense of the moment. We're launching a pop education training to make sense of the moment, what this means for our country on some of these attacks that we're seeing on our democracy, and a roadmap of how we can all engage and where we go from here. So signing up to attend one of those, I would also recommend, because it's really going to be up to all of us to defend our rights and to speak up for those who aren't able to. And, there's also big mobilization events. There's a big No Kings event that a lot of our groups are engaging in. So, those are many specific tactics, but ultimately I would say showing up right now is it's so important. And it's that consistent engagement from us from all of us is essential right now.
Julia, over to you.
I agree. I think we all have a role to play, and we each have different things we're good at. And so some of it is thinking through, what are you really great at and how can you apply it to an issue that you care about? I referenced this a little bit earlier, but something we're seeing at our organization is the plaintiffs that we represent and their advocacy. The opportunity for folks with lived experiences to talk about how policy, which can seem like this distant theoretical thing, has really impacted their lives. And so I'm going to share one story with y'all from one of our plaintiffs. There are many more that you can find on our website, and I encourage you to kind of, and in media coverage, to get familiar with these so that you can share them with those around you if you're really great at telling stories. This is the story of Amanda Zarowski, who's our lead plaintiff in a suit that we filed in Texas. Her water broke at just 18 weeks into her pregnancy, and her doctors knew that her fetus couldn't survive the pregnancy. But because of Texas's very strict abortion ban with very high penalties, including jail time and enormous fines for doctors, her doctors didn't terminate the pregnancy. And Amanda developed sepsis 3 days later. While she fought for her life in the ICU, her family flew in from across the country, fearing the worst. And Amanda recovered from her infection, but her fertility is permanently damaged. So she led the suit that we filed in Texas on behalf of 22 women and their doctors, all seeking to clarify the exception in the Texas abortion ban for medical emergencies. Amanda has told her story on the stand in an independent documentary called Zarowski v. Texas that premiered at Telluride, in congressional hearings, on stage at the Democratic National Convention. But when she tells her story, she often leaves out one key detail that's key to my work, which is that she worked for Indeed. She worked for a company that had put out a study on the damage that bans do to workers. And she says that without her employer's support, she couldn't have recovered gotten the treatment she needed, and then participate in our lawsuit with the comfort that she was able to. And now she's since left the company. She's a full-time advocate, but for more than a year, they supported her as she was juggling her career and the case. And so this sort of leads me into another kind of unlikely and new way of that we're organizing and advocating in the Center for Reproductive Rights, which is the corporate engagement work that we're doing. This is a new program that I've stood up in the last 2 years, and we're doing it because we know that employers have such an important role to play in the space. They ensure that their employees can afford to stay healthy and productive. They're competing for the best and brightest, which is getting harder and harder to do in states where people don't want to live or work or go to college when it's dangerous to be pregnant there. And so many private sector leaders are quietly behind the scenes working to try and get better company policies and better public policies on the books.
Thank you, Julia. Jamila, over to you.
Great. I'm actually going to take this time to go back to trusted messengers because I did want to elaborate a bit more on that. Selfishly, it's one of my favorite parts of the job. And reason being is it really gives us these new entry points into audiences that we might not already have access to. And we know that this work is going to take all of us, right? And so this has been work that we've been doing for probably the last 3 decades now. And as I mentioned, it's across storytellers, celebs, brand partners, corporate partners at times, and certainly our influencers. And just to give you an idea of what some of this work looks like and how powerful it is, I can give 2 examples, but I'm going to start with one that I don't know if a lot of people are aware of. And that's our work with storytellers. So storytellers can be a person with a personal connection and story with either Planned Parenthood or sexual and reproductive health. However, in this instance, when I say storytellers, I'm talking about those working across TV and film. So it's directors, filmmakers, actors, producers, like it goes on. And we've worked across some of your favorite shows, Handmaid's Tale, Palm Royale, that was a fan favorite. This Is Us, Little Woods, Euphoria, Survival of the Thickest season 2. I mean, the list goes on. We've been doing this for a very long time. And we have ourselves established this credibility where these leaders behind the scenes want to make sure that they're being socially responsible so that, one, they're not pushing disinformation and misinformation, right? It's the less harmful narratives that are medically accurate and sensitive depictions of SRH in the media. The reason that this work, along with our trusted messengers, is so important to us is not because it's like fun and sexy. You know, obviously it's popular, so it does a lot for us, but it's part of a longer term strategy goal of ours, and I'm sure many of ours on this call, and that's around shifting societal beliefs, attitudes, and behaviors as it's related to sexual reproductive health and very poignantly towards abortion. The other thing I do want to say with that is we all are also our trusted messengers within our own groups, right? And so when we think about getting involved, it's very important to also think of those areas where you're able to influence, and that can look very differently, but I don't think it's extremely different than how we would leverage some of our trusted messengers, right? Like it's showing up, you know, sharing a message, helping us fight disinformation, coming to something in person and showing up as an advocate. It can be helping organize, donating. I mean, the list goes on. And the beauty of advocacy is there isn't a one size fits all. I think a lot of times we're a little like, going to the rally might not be for me. But the truth of the matter is there's so many ways you can do it, down to just talking to 5 family members and friends. Like, share what you all heard today. It matters, and it goes a very, very long way. You know, I encourage us all to find our lane. You know, it takes everyone to do this work, and this work is big. And so with that, I just want to encourage you to find what works for you and step into it.
Thank you, Jamila. I want to start the next round of questions with you, Sabrine, because the work that all of you do is deeply human, and I think it's a personal endeavor as well as a professional endeavor in your capacities. But could you speak to your individual personal motivations for taking this on? Because it can't possibly be easy. You're navigating um, very difficult terrain. So I'd love to hear about your personal motivations and what keeps you in this fight. I'll start with you, Sabrine.
Yeah, absolutely. I would say my motivation comes both from my past and my future. And so what I mean by that is from my past is I myself am a survivor of gender-based violence. I was in a physical and mentally abusive relationship while in college, and it has really shaped, that experience has really shaped who I am today, but has stayed with me to motivate me to, in whatever way I can, help provide a voice for survivors, and especially those silent survivors who, many who live amongst us. And then in terms of from the future perspective, I remember 6 months ago, I was, trying to explain to my 8-year-old daughter the work that I do at Saki at a very high level. And I mentioned to her that, Saki works to empower women. And her response was, why only women, Mama? Nowadays, don't men and women get to do all the same things? And it really took me aback and gave me some pause, because that really is the North Star, right? Like that is the dream, that we all get to do all the same things. So for me, that is like, truly one of the big motivations, that we create a world where, both, I have a son too, so both my son and daughter can both live in safe spaces and get to do all the same things.
Thank you, Sabrine. Thank you for sharing that. Julie, I'll turn over to you.
Well, I grew up in a very progressive Mormon family. And I love the reactions I get when I tell people that, because they're generally quite surprised. But I promise it's true. We would get home from church every week in my family and sort out what we had just heard that we thought was valuable and what we disagreed with. And so my parents and my mother especially taught me the value of working within a system or community to change it for the better, which is what she was endeavoring to do within our religion. And in the work that I do now, that upbringing constantly motivates me, because I know that change is possible. When I was a kid, the Mormon Church asked my mom to lobby for pro-life policies at the Virginia State Legislature, which is where I grew up. And she declined that opportunity because, of course, she supports abortion access. But today, she's in her mid-70s. And when I took this job, she was a little nervous about talking about it with her friends at church. And so she came up with a script. And when someone at church asks her what her daughter does for a living, she says, "I don't know what you think about this, but I couldn't be prouder. My daughter works for the Center for Reproductive Rights." And the kicker is that 9 times out of 10, they light up. They say, "Good for her," because what we're doing isn't political. It is restoring a basic human right. This is about a common healthcare intervention. It is about access to IVF. It is about having the birth experience that we want. And we need to make sure that these things are safe, affordable, and available. And when you get to people one-on-one, even in a more conservative circle, they generally agree.
Jamila, over to you.
Yeah. Just to give some backstory, prior to coming to Planned Parenthood, I had spent the bulk of my career in fashion doing brand marketing. So if you can imagine, most of my work and my goals were tied to a bottom line. One year doing a New York Fashion Week event, it was a small, intimate dinner, and it was hosted by music and fashion icon Pharrell Williams, who probably was one of my first influencers. And during that dinner, I remember hearing him say he wanted to do a jean for Planned Parenthood. You know, he wanted to design something and sell it, and a portion of the proceeds would be donated to Planned Parenthood. And this had followed one of our guests, like openly talking about her experience with, Planned Parenthood and the care she had got during a miscarriage. And it was in that moment that I realized how storytelling can spark conversation that leads to action in these unlikely places and unlikely allies. So when I talk about things like trusted messengers, it's not just because I know the value and I've seen the impact from the inside the national office. It really is because I have this personal connection. That moment has stayed with me since I've been here. And just to give you another nugget, I came in as a managing director, but my goal was to do this work. And over time, things just came together. I got new teams, and like just that moment came full circle. And what had happened was I had been taken from the soft supporter to someone doing this work day in and day out and doing it in the work that I found my lane in. So I do like to really share that, because I do think we sometimes think everything has to look a certain way. There can be a lot of different things that pulls us into this advocacy and into this mission.
Molly, it's your turn.
So, I mean, probably like many of you, when you grew up, you went when you were a child voting with your parents, and that was my experience. I went to the ballot and voted with my dad and mom at our neighborhood elementary school, the same elementary school I went to. And I remember being very young, like maybe kindergarten or first grade, and our very wealthy neighbors were there, and they were in front of us and got a ballot, and then we got a ballot, and I was like, Dad, they only got one. And he said, yeah, we're all getting just, all of us, just this one ballot, and then I looked around more and saw, another family that I knew from school who was lower income, a family who was not white, and, just it was all like mind blown for this 6 or 7 year old of this like sacred, precious moment I was in on election day, and the sacred ballot that everybody was given. And that moment stuck with me. And then as I got older and more privy to our history and to really what the inequities that exist in our democracy, our ugly voter suppression history, Jim Crow laws, all of that, I learned that, maybe that moment the moment is sacred, but it's maybe not quite providing that equality that I thought it did when I was 6 or 7 years old. But that feeling stuck with me, and that feeling of we could have that. What can we do to make that happen, where we are protecting that sacred moment, and it truly is that moment of equality as well. And so that's kind of the little girl in me who gives me a pep talk sometimes.
Jamila, we didn't rehearse this, but we all ended up hearing each of your stories, and you became storytellers. So that was a proof positive of your statement. While we kind of wrap to a final question, it's been woven through everything that you've said, but I would love to restate for our audience, if there's one action, one resource, one step or message that you would like to leave our audience with. I want to yield my time to each of you to do that. We'll start with you, Julia, please.
I'm going to cheat again and do two.
Please.
One is to listen and talk. So 3, because listen and talk, I do as one. That keep educating yourself about what's happening in the world and talk to others about it. Jamila mentioned this earlier. Your family, your friends. So keep getting educated and keep talking. And there's, I can drop in the chat a place to get educated about sort of business relevant developments that are happening within the reproductive rights space. And then the other is as you then think about what more you want to do, figure out what you can uniquely do through the position that you hold within your organization or within your community or within your family. What is your unique value add on the issue that you are passionate about? There are endless amounts of things to work on right now. It can be very overwhelming. So find the thing you're passionate about and what you're good at to make change.
Thank you, Julia. Sabrine.
I wanted to dovetail on what Julia mentioned in terms of, keep educated and talk. And I would say, and ask questions. I feel a lot of the topics that we talked about today have been stigmatized, but because people don't bring them up. Because Julia, your story was really powerful, I think, because a lot of times we also assume that, people will think a certain way. We're afraid of sharing our stories, but the asking questions and repeating and bringing things up to reduce the stigma that has been falsely assigned to a lot of our stories and the topics that we're talking about, I think will continue to help with pushing back against the false stigma that has been assigned to some of these topics, which will then further help us find solutions to address them.
Thank you, Sabrine. Molly, I'll turn to you next.
I would, I echo all of the great advice of, find what works for you to get involved, that it's not one size fits all. I'll drop our link, ACLU's link of the volunteer to join our volunteer team. We're doing a lot of different ways, a lot of different I'd say it's like a menu of options that you can pick from and pick what works for you. We're doing a lot of things in state, and I'm going to events. Other folks from our national team are going. So it's something I'd love to be able to see folks at in the future. And if you are at something that I'm at, please introduce yourself.
Please do drop the link in our chat, and the team will share on the public chat as well. And Jamila, last comment goes to you.
Yeah, I'm actually going to lean on the urgency of the moment for us. And that's because this CTA, if we are able to break through and get people to take it, there is still a chance for Planned Parenthood, right? And so I do encourage you to call your members of Congress. We actually can make it very easy for you. All you have to do is text CARE to 22422, or you can go to I'mForPlannedParenthood.org. This is what we'll be pushing for the next couple of weeks, and I feel that we're going to be able to do that. But in addition to that, in just complete advocacy, I definitely encourage you to just think about all that's available. There's volunteering to be escorts. There is holding your own fundraiser. There's obviously donating. We've even had things like folks host plays at home, about this conversation. So it's really about, let's help normalize the conversation, because it's healthcare, right? And it's healthcare that we decide that we should be able to have access to.
Well, thank you all for your time. I don't know how you did it, but I managed to hold alarm and optimism in my head through the course of this conversation. So, and you told us your stories, and you told us stories that actually capture the human element of each of what your organizations do. So I cannot thank you enough. We will send the resources, and if anybody wants to follow up, we'll make sure that there are ways in which they can connect with you. But thank you for the time. It was an absolute privilege to share the stage with the four of you. So thank you very much. I hope to connect with each of you soon.
Thank you so much.
Thank you.